Hi, my name is Robin Tarragano. I'm with the Senior Medicare Patrol. I'm a volunteer, so thanks everyone for being here. I have been volunteering through the Senior Medicare Patrol, which partners with Catholic Charities, for about 7 years. And also, if anyone has ever heard of the Senior Health Insurance Program, that we help people figure out some of their Medicare during open enrollment. We help you decide what Part D plan is good for you, and basically help with any kind of Medicare or Medicaid issues. So I've been doing that for about 9 years through the state of Illinois. And I do Medicare fraud presentations like these to educate people about fraud. There's about 60 billion taxpayer dollars that are lost through fraud on an annual basis. So it's pretty huge, which is why it's really important to educate people about that. But the good news is that you can protect yourself and your money, and I'm going to show you how through the presentation today. So I passed out some materials for you to take home, so I want to make sure everybody has everything. First, we have the one-page sheet that tips to avoid Medicare fraud. Everybody have that? Okay. And then we have the Senior Medicare Patrol brochure. It gives you some great, helpful, kind of a quick cheat sheet on Medicare fraud. Also has the phone number for SMP. And then we also have a health journal. Sometimes people keep track online, so whatever way works for you, but the key is to be able to keep track of your doctor's appointments. Sometimes if you have a lot, it kind of hard to keep track of, and the only way that you'll know if there's any errors or any problems with your Medicare is if you kind of keep track and of all your appointments and things like that. Also, it has a medication list in here, so a lot of good tips and ways to keep track of all of your medical appointments. And then this is a kind of a handy emergency card to keep in your wallet from Age Options. So everybody have all the sheets, and thanks for signing the sheet. That's just so we can keep attendance. So first I'm going to give you a little bit of information about the Senior Medicare Patrol, which is what I'm working through that organization to educate seniors like yourself about Medicare fraud. I'm going to just give you a brief definition of what fraud is and what a billing error is, because those are two very different things. Both of those are very important to be able to keep track of, but we want to make sure that everybody understands the difference. I'm going to give you some examples of fraud, and then most importantly, tell you how to protect yourself against fraud, be able to detect fraud, and be able to report fraud. And give you some of the serious consequences of fraud, one of which I already explained about how much money is actually lost every year. So the Senior Medicare Patrol is statewide. I volunteer through Illinois. It's administered by an organization called Age Options, and the brochure that you have here, Don't Be a Target of Healthcare Fraud, is put out by Age Options. And it's funded by the Administration on Community Living. And the purpose is to empower seniors like yourself about Medicare fraud so that you can protect yourself, detect fraud, and also report it. So one of the things that we do through SMP is educate seniors through presentations like today about Medicare and Medicaid fraud. I go to libraries, I go to senior buildings, villages, things like this. Also healthcare, a lot of different community events, just to be able to get the word out there with all different types of people, all different geographics, to make sure that everybody has that information. And it is statewide, so it's in 50 different states. We assist with questions about billing errors and fraud, which I'll explain a little bit more in a minute. We report fraud to investigative agencies, and it's not just fines that people get for committing fraud. There's some pretty serious jail time that's also imposed on that. And also we recruit volunteers for the program. I started out working with the Senior Health Insurance Plan, helping people with Medicare and picking their Medicare plans and things like that. And I attended a presentation like this through the Senior Medicare Patrol, and that's how I got involved in volunteering. So there's some information and a phone number on the brochure too that gives you some great information that you can contact if anybody's interested in volunteering. So healthcare fraud, Medicare fraud, the main difference between that and a billing error is intent. So there has to be an intent to deceive. Because as we know, everybody's human and people make mistakes. Basically, errors are just that. They're just basically mistakes. Nobody has intended to deceive you. Maybe accidentally the wrong name or accidentally putting in the wrong information or something like that. Potential fraud would be billing Medicare for services that someone didn't need, someone didn't receive, not medically necessary, something different than what you actually received. There was an instance where it was a senior building and somebody came in and they were just organizing a bingo game. They went around, they collected everybody's Medicare numbers, and they billed Medicare for mental health services. So that would be an example of billing for a service that was different than what they actually received. And also duplicate billing. So those are the type of potential Medicare fraud, but the key to remember is the main difference is the difference between an error and a difference between fraud is an intent to actually deceive rather than just a simple mistake. Okay, so now I'm going to give you some examples of fraud. I'm constantly updating my presentation because unfortunately there's always new and creative ways that these people commit fraud. This one is pretty recent. It's called the braces scam. It was actually just announced April 9th, and if any of you get the Daily Herald, there was actually an article about it just recently, April 10th, in the Daily Herald. I received one of these robocalls myself about braces. So it was a nationwide billion-dollar scam that federal agents broke up. And they were basically giving unneeded orthopedic braces, neck braces, back braces, shoulder braces. Anybody ever get a phone call on that recently? Yep, a lot of you, unfortunately. Yep, when you get those, just hang up. But it's pretty prevalent. So it was actually one of the biggest frauds that the Attorney General's office has ever prosecuted, which is pretty major because every time I get these fraud alerts, and every time I look at one, this is the biggest one. Then a month later, this is the biggest one. So currently, this is one of the largest ones, unfortunately. So what happens is they're call centers, they're offshore call centers, and they call people. It was they were involved, telemedicine firms that basically do like phone consultations with doctors over the phone, medical equipment companies. And the numbers are pretty staggering. They billed Medicare $1.7 billion. Now, fortunately, Medicare didn't pay out all of that. They paid out most of it. Some of it, there was a red flag and they didn't pay it out. But 1.2 out of the $1.7 billion was actually paid out. So that's how huge it actually was. What they used the money for, these scammers, they purchased exotic automobiles, yachts, luxury real estate in the US and abroad. So it's pretty major fraud scheme that happened. So what happens is the telemarketers were called. Mainly they were offshore call centers, and those are the calls that a lot of you received and that I received too. Basically says, hey, we can give you some free braces. They advertise on TV, they advertise on radio. I haven't seen any of those, but I'm sure those will be popping up. And they would call people. They would say, I can give you a free brace, or multiple braces in many cases. I just need your Medicare number. Well, first, when you hear the word free, not many things in life are free. That's pretty much a red flag that there's something that's going on. Also, if they ask for your Medicare number right away, that is not free. There's a reason that they're asking you for the Medicare number. They're asking you for the Medicare number so they can bill Medicare. So that's no longer free. They would pay bribes to these telemedicine companies for these companies to get doctors to write prescriptions for these braces that were not needed. So they paid kickbacks to them. And then they would transfer people once they had somebody on the phone, they got their Medicare number, they verified that they have coverage, they would transfer them to these telemedicine companies, and then they would speak to a doctor, one of these phony doctors, give them some brief information, and then the doctor would write a prescription, which was a fake prescription for medical equipment that was not needed. So the call centers then would sell these prescriptions and these orders for durable, they call it durable medical equipment, which is things like canes and braces and wheelchairs and things like that. So in order for Medicare to pay that, there has to be a prescription from a doctor, and a doctor needs to order it. So what they would do is they would pay the doctors to write these orders. The call centers would get the orders from the telemedicine companies, and then they would send them to the medical equipment companies that would fraudulently bill Medicare. So there's a lot of different layers here. The telemedicine companies, the call centers, the medical equipment companies. All of these people were involved, which is another reason why it was such a huge issue. And they were all benefiting from each other at the advantage of the seniors. Some people think, well, if I didn't pay for it, obviously, Medicare paid all this money, what is the harm? Well, if you needed this equipment later on, Medicare is going to look at your account and see that they already paid for it and not pay for it. Plus, if Medicare keeps losing all this money towards fraud, that could also actually threaten the whole Medicare program, which right now is in kind of financial straits, which you might have been reading about recently in the paper. So that's just one other added expense that Medicare doesn't need, is all of these extra fraud. There's so much money that's lost through fraud, and we need to obviously keep that Medicare program solvent. So even though you may not personally be paying for it, in the end, it's costing you money because it's costing Medicare money. And not only could that kind of threaten the solvency of the Medicare program itself, but also your co-pays, your deductibles. As you know, all those costs keep coming up. And a lot of it is not just due to healthcare costs, it's due to all this fraud that's being perpetrated. Another very recent one is called, yes, question?
Question on that one. I haven't been following it. I'm glad that they're must have been et cetera, et cetera. My question, two questions. Offshore. Define the country offshore.
Well, there was the Philippines. I think Latin America was one of them. There were several different ones. So when they call in, and sometimes you don't know, a lot of times with these numbers, is they buy banks of numbers, and you don't know that where they're calling from. Basically.
And you know, I'm not a linguist, but they sure as heck sound like they're from Pakistan or India.
Yeah. Well, I don't know. There's, like I said, it's many different countries. In this case, you know, there was about 3 of them.
These offshore, are these offshore doctors, offshore medical?
These were the call centers that were offshore. And then the call centers were kind of in cahoots with these telemedicine companies. And they were the ones that were getting doctors to write prescriptions. Now, I don't know if the doctors were here in the US or they were associated with some of the same countries that the call centers were. So not quite sure, but there's fraud. I mean, there's offshore fraud. There's also, you know, a lot of fraud here. So it's pretty much widespread.
This one was just recently exposed, busted.
Right, just in April, so just a couple months ago. So yeah, very common. There's another very recent one too. I haven't gotten any calls on these. I don't know if any of you have heard of the genetic testing scam. That one's pretty recent. It was started out in several different states, and Illinois just received its first report in March. So this is relatively new, although not new for several other states. I think California was one of the main ones that it was happening in, but now it's starting to happen in Illinois. What they do is they offer free genetic testing. Sometimes it's over the phone. Sometimes it's at health fairs. And then they would go ahead and get people's Medicare numbers again. Again, there's that word free, which we know is not free. And then the second part of it, which asking for people's Medicare numbers so they can bill Medicare. That was an enormous amount of money that they were billing. For these genetic testing is very expensive anyways. And so they were billing Medicare just like hundreds and hundreds of thousands of dollars. And the people, sometimes they would get the results and sometimes they wouldn't. But either way, it wasn't something that was needed. Medicare does pay for some genetic testing, but it's extremely limited, and it's confined to just several specific type of diagnoses, like cancer is one of them. So you can't just have any type of condition and have it covered by Medicare. So that was a tip-off too, where they were basically saying, you know, oh, we can offer genetic testing, and some of the conditions that people had were not even eligible for that. So Medicare would only cover a small list, and again, it has to be by the treating physician. So not only does it have to qualify for the condition that it's being tested for, but it has to be ordered by the physician that's actually treating the beneficiary. So they would get around that by getting just, unfortunately, a lot of doctors that kind of cooperated with them and falsified a lot of records just to get those payments made. So that was one of the new ones. This was a new one to me that I haven't heard of, where pharmacists are actually involved in fraud, and they are prescribing prescriptions to dead people, which obviously they don't need that anymore. And then they were billed for expensive medications that were never actually obviously dispensed. So that was another recent one. Basically, durable medical equipment, which I explained is like canes and braces and wheelchairs, that's one of the main areas of fraud, especially in Illinois. That's why if anyone has ever received any of those, Medicare has changed a lot of the rules, and they have a competitive bidding system, which the durable medical equipment companies have to bid to get a contract with Medicare. Medicare doesn't just pay for any equipment from anybody because of all the fraud. And that was one of the ways they were trying to prevent it. And they would make these companies, you know, they would check their credentials, they would make them bid for a contract to make sure that it was, you know, made sense economically. They weren't like charging people crazy amounts of money. And in order to get covered for the medical equipment, it would have to be through a Medicare contracted provider. So that's one of the big areas of fraud and one of the ways that Medicare is trying to go ahead and prevent some of that. Home health care fraud is actually the #1 type of fraud in Illinois. So a lot of the types of calls that the Senior Medicare Patrol receives are for home health care frauds. One of the largest health care fraud cases was just last year. Over 600 people, including Chicago area physicians. So we talk about offshore, but there's also, unfortunately, a lot of fraud right here at home, pretty close by. So it's not just something that happens somewhere else. They were charged with falsely certifying that patients needed home health care, which, just like with the genetic testing and durable medical equipment, home health care requires very specific issues that need to be met. The person has to be certified homebound by a doctor. They can't just say, oh, I just need somebody to come home because it's inconvenient for me to maybe get physical therapy outside of the home. There's a lot of different regulations as to what homebound means, but that needs to be certified by a doctor. There has to be a plan of care. You need a certain type of physical therapy 3 times a week. So there's a lot of regulations for it. But the doctors would go ahead and make up some paperwork and make up, conditions that people had, and basically falsifying their need for home health care, knowing that they did not need it and they were not homebound. They were making kickback payments. Kickbacks are basically bribes to the owners of home health agencies, to the physicians for referring the patients to the agency. So the doctors would get money, they would get bribes, they would refer them to the agency. The agency would be providing services and fraudulently billing Medicare for services that were not needed. There was a husband and wife in the northwest suburbs that were doing this, falsifying nursing reports. Over $6 million was overpaid in that situation, which sounds like a lot, but compared to the $1 billion one we just talked about with the braces, that's not even half as much. So there's also another issue which I always want to have everybody be aware of, because a lot of people may know people that are in skilled nursing facilities. And there was an issue for several years where skilled nursing facilities were saying that if someone was receiving physical therapy, but they were not showing improvement, that Medicare wouldn't pay for it, and they would sometimes, just tell people that they were no longer qualified for skilled nursing. They would kick people out of skilled nursing homes, or they would stop therapy. I don't know if any of you have heard of that before, but there was litigation that was done which stopped that, and they basically said that you need to continue to provide therapy as long as someone is maintaining where they are. So they don't have to improve, but as long as they are maintaining the level that they are, it's to help them maintain and not deteriorate anymore. So, had you had that situation before? You're kind of nodding your head.
I'm just glad it happened.
Right, yeah. I actually personally had a situation where my stepfather was in a nursing facility and he had some back surgery, and they were basically had on a checklist, you have to be able to do this, 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 and that, and pushing him to do things that were causing him a lot of pain that he couldn't do, and threatening that if he didn't, cooperate, that they would cut off payment. And I've heard a lot of stories just from presentations and things where people are having that happen. So that's just something I want people to be aware of, that if you ever have that situation, the person does not have to be showing improvement. They do have to be, not saying I don't want physical therapy and refusing it, but if they're cooperating with the physical therapy, they don't have to be showing improvement for it to be paid. And the nursing facilities cannot refuse to bill Medicare and cannot refuse the treatment. So just wanted to make sure everybody was aware of that. There's also a scam called, they call spoofing or imposter scams, where people receive phone calls and it looks like it's somewhere that you've heard of before. Has anybody gotten a call and they say, I'm calling from the IRS, or I'm calling from Medicare? Yep. The IRS is a big one, especially since we just finished tax season. So unfortunately, they have technology where they can make it look like they're calling from somewhere else. So you can't trust your caller ID, unfortunately. And I always tell someone, if you haven't called that person, you don't know that they are who they say they are. So just be really aware of that. It could be your bank calling to verify a bank account number. There was a big issue when they changed all the Medicare cards, which was great. They took the Social Security numbers off, which was a long time coming, but obviously very expensive, so it took them a while to do. But when the new Medicare cards were coming out last year, there were calls that people were getting saying that they're from Medicare, and people had to wire them money to receive their cards. So hopefully that's not happening as often because, all those cards have been sent out. But people that are new to Medicare, just be aware that that's something that might still be happening. There's also the grandparent scam, right? That's exactly the right thing to do, is to call and say, did you send me this? And any kind of emails and things, you don't want to open any attachments, as a lot of you probably know. But yeah, good point. It's not just phone calls, it's email. Sometimes it's door to door, which can be even scarier. But it's, pretty much happens everywhere. But the IRS ones, they can get pretty aggressive. I had some calls where they said, the local authorities are outside waiting to arrest you unless you mail us money and stuff. And so it's like, they really try a lot of intimidation methods. I think that's been publicized a lot where people are pretty much aware of it now, which is surprising that they keep trying to do it. But there's the grandparent scam. Have you heard of that before? They actually recruit college kids to sound like they're people's grandchildren, and they'll call up and usually they'll say they're in some foreign country and they're in trouble and they don't want the grandparents to tell their parents, and they say you need to wire money, otherwise they'll put me in jail. I actually spoke with one of those people because my mother had somebody call. I was just about to walk out and the phone rang. I picked it up. And because it was my mom, and she said, oh, well, my nephew he was in Canada for one thing. And she goes, well, they said he's in Mexico and it sounds just like him. And I said, hang up, this is not, this is a scam. And then the person actually talked to me. She goes, well, let me have you talk to him. And they'll usually hang up, and they do that. And he was saying, well, you can believe what you want, but your nephew will be in jail if you don't, wire money and everything. And I explained to him that I do these fraud presentations and I would report him to the Attorney General, which I did, and suggested he never call back again. But they prey on people because the grandparents are obviously concerned. They say they sound like their grandchildren, and that's kind of one of the ways that they can get people that are pretty vulnerable, and that they sound like their kids, they're college kids, and they say they want them to wire money, which is also a flag, because if you wire money, there's no way to trace that. So, if you're concerned, hang up and call your grandchild, find out where they are, call the parents. But that's one that's been around for quite a while. Also, Can You Hear Me was on the news recently. Have you heard of that one? It's all different companies. They'll call up and they'll say, can you hear me? The person says yes. They record them and say, oh, they say yes to purchasing all these different products and things like that. And then they'll ship you a bunch of stuff you don't want. So, a lot of those are, just kind of be aware of that. And that's something that anybody would fall for, can you hear me? So just hang up on people when they do that. That's the best way to get rid of that. The Illinois SMP program received a lot of reports from consumers who gave their Medicare numbers or Social Security numbers to people who contacted them on the phone, again, offering them free services like massages. They would bill home health care for people that receive massages, not massage therapy, just massages. When they did receive skilled nursing care later, it was denied. So that's why I said, even if you're not paying for these directly, if you do need those benefits later, then Medicare could say, well, we've already paid for that. So spoofing technology is something to be aware of. They can mask their real phone number. Sometimes you get a phone call and it looks like it's yourself calling or your spouse. And you're wondering, well, how can that be? Because that's my own number. And that's another instance of spoofing. Yeah, because hopefully they're a contracted provider that you're getting it from, so you don't pay the difference. But yeah, you can see the huge amount. When you look at the Medicare, he's talking about the Medicare billed amount and the Medicare approved amount.
Right.
I mean, sometimes it's like $1,000. Yeah.
Some dollars, and Medicare pays $160 or something
Right.
like that.
And the good news, they have to accept that because they're a contracted provider, which speaks to the point when I was explaining to before about the new bidding process for medical equipment companies. Because before, they would just charge that amount, people had to pay that. So the fact that they are limiting the number of people that they will have contracts with and they will agree to let service, so that kind of saves you from those exorbitant sums. But somebody's paying that, as you can see, the difference between the billed amount and what Medicare approves, which is why it's always great if you can to go to Medicare approved, providers. When you think about why is somebody calling up asking you about your personal medical condition, which is an invasion of privacy on top of the fact that they're obviously trying to scam you. But that was a good comeback. I like that one. So one of the ways to protect yourself is never give your Medicare number, obviously, to anyone who calls you. If you haven't called them, as I mentioned before, you can't trust that they are where they where they say they're from. So technology is a great thing, but sometimes it can be used against us. So, we had the caller IDs, or you thought that was great, you knew who was calling you, but then unfortunately, it can be kind of turned around on you. Don't trust your caller ID. Don't press any numbers to get off of a list. If you ever had any calls and they'll say press 1 if you don't want to receive these calls or anything, that tells them that that's a legitimate phone number. Because they'll buy banks of numbers. Some of those numbers may not be in service. They may not be an actual resident. They might be a business. So they're fishing around to see, are these actual, real phone numbers? And by as soon as you press 1, they know that that's a real number. Also, to your point, you may get emails that way too that say, if you want to get off the list, click this or respond to this. Don't do that, because the same thing, they know that's a real email that they've reached in, and you'll just get more and more of them. Mm-hmm.
I'll get an email and it will say, text stop.
I haven't seen that one before yet.
If you don't want it, and I have tried, then my computer won't let it.
Oh, it doesn't go through. Does it say this is like a virus or something? Yeah, so it's protecting you. Yeah, so don't ever text, email. If you don't know, where this came from, and you don't, if you haven't called them directly, you don't want to click on any links, do any texting, pressing any numbers on your phone. The best thing to do is just to hang up. But if you do have a caller ID, one thing you can do is get the phone number off of it, and you can report it to the Federal Trade Commission. Now what they do is, they do get these reports, and they can block these numbers, but unfortunately what happens is then they will just find a new number, but at least it helps a little bit, and they can stop some of this from going on. Let's see. So one of the Attorney General's office talking about hanging up, their slogan is basically, hang up, it's not rude, it's shrewd. Because a lot of people they want to be polite. They don't want to hang up on people. But you're not being rude, you're being smart by doing that. Because the longer you're on the phone, even if you're trying to get rid of them, but you're trying to be polite and not hang up, you may be divulging information without really intending to. Once they get you engaged and they start talking to you, it's easy to give out information. And they can do a lot. It doesn't necessarily have to be your Social Security number. They can do a lot with just your date of birth, where you live, because of the internet. There's a lot of things that they can put in, just little bits and pieces of information to find out things about you. So the best thing to do is just basically hang up. And remember that Medicare does not endorse companies. They will not tell companies to contact you for any kind of medical services or medical information. So if somebody's saying they're calling from Medicare and Medicare told them to call, or somebody goes door to door and Medicare sent them to provide home health care, you know that that's a scam, because Medicare does not endorse any companies and they do not contact people to offer services. If you need health care services or any kind of medical services, best thing to do obviously is call your doctor and obtain a prescription for that. So don't accept services from any presentations you might go to. I mean, health fairs are great, but sometimes, they try to do backgrounds on people, but sometimes there could be vendors, that are shady and basically marketing things that they shouldn't be. So just be really careful with anybody that contacts you, whether it's over the phone, through the email, through a presentation. And don't let anyone except your doctor or your medical providers review your medical records. Don't give those to any, that's your private information between you and your doctor. Yes?
I get a call because of they'll say, this is the VA. Mm-hmm. And are you aware of the 2019 tax? We'll make sure you're aware.
Like a tax benefit or something?
Yeah. For my house.
Mm-hmm.
And they'll ask maybe the last 4 digits of my Social Security.
Right. You don't want to give those out. People think if it's the last 4, it's okay. Those are actually the identifying part of your Social Security number. The beginning numbers are usually, from what I remember, is geographic location and some other things, but the last 4 are really the identifying numbers. So a lot of times they'll say, oh, I just need the last 4. they can do a lot with the last four numbers of your Social Security. So you don't want to give them. Yeah, well, yeah, everybody has done something, before and afterwards. You're thinking, oh, I shouldn't have done that. But that's part of what the purpose is, to go ahead and do presentations like these, is to educate people. So that way you know about it and going forward. Because a lot of people thought that was fine to give your last four. But it's not. And basically any kind of personal information, whether it's your Social Security, your Medicare number, like I said, even your date of birth, something that seems pretty innocent, unfortunately, people can use that. So just going forward, just to protect yourself, you don't want to give that information out. You don't want to sign up for anything before reading it, especially any kind of like blank forms or timesheets, like nursing timesheets. Make sure this is a nurse that, if you went to some kind of event, like I was talking about the massages or the bingo or things like that, and they'll have people sign timesheets and say they were doing skilled nursing care or mental health or something. Just be real careful with anything in life, what you sign. You want to read it first. So some of the information you don't want to give, we went over a little bit of that, your Medicare number, your Social Security number, also your credit card or your debit card number. So I know a lot of people will buy things over the phone, but as long as you contacted them and you know who they are, that's fine. Charities too, you can get a lot of charitable calls. I usually tell people I will not, give money over the phone, but I'd be happy to read any literature, if it's something that I'm interested in. Otherwise, I'll just hang up. But if I don't think it's a scam, and even if you think it's legitimate and you're interested, then those companies should be able to send you some information in the mail. So you know what you're getting. Your bank account information, somebody calls, says you're from your bank. I think you had that instance with the email. To your checking number, your routing number, and then your date of birth. Like we said, they can steal other information from that. And remember, free services don't require a Medicare number. So anytime anybody says, we're going to offer you free services, we just need your Medicare number, you know right away that that's a scam. Is anyone on the do not call register? Or have you heard of it? You are? You are? Great. You do need to re-register every year, because a lot of people will say, well, it doesn't work. I'm like, well, did you register again the next year? After a year, you'll drop off. So you can do that for your cell number, but I'm glad that a couple of you are on that. It doesn't stop all calls, but it does stop a lot. So it will prohibit basic like cold calling, sales calls. But if it's a business, even if you're no longer doing business with them, it won't stop calls from places you've already done business with. Charitable calls, political calls, those robo-political calls, it won't stop those, unfortunately. Telephone surveys, things like that. But it will stop a lot of just basic cold calling for a company that you have not dealt with before. It's donotcall.gov. that you can register online. Also, the phone number, if you want to call the number instead of going online, it's 888-382-1222. Again, that's 888-382-1222. If you do receive a call that you shouldn't be getting, and we kind of went over some of the things you may still get, but if it's a call you shouldn't be getting, you want to get the person's name, the date they call, and you want to report that, because they can be fined over $40,000 for each call they make that they're not supposed to make if you're on that list.
I've called
So-
I think it's the Illinois State, because I was getting a bunch of basically almost harassing calls, solicitations and all that. So I called and gave them the information, and it really seemed like, okay, fine.
They didn't know. Do you know what organization?
Geez, we're overwhelmed with this data, so, okay, fine.
I'm not sure who you call. There's a couple different agencies, though. You could try calling the Federal Trade Commission. They kind of are in charge of that type of thing, as far as phone calls and things. The other thing, just to stop them, personally to get them, is that some of the phone companies, if you give them the number, you can ask them to block it. If you happen to have the number, if it's a bunch of different, calls, but if it's like one number that keeps popping up, that's one way to stop them too. But unfortunately, the person that you talked to wasn't very helpful, but you can call the Federal Trade Commission, also the Senior Medicare Patrol. Senior Medicare Patrol, though, is for healthcare fraud. But if these are just basically other types of harassing calls, then that would be the Federal Trade Commission. That I have some numbers for you too at the end of the presentation. But yeah, that's unfortunately, you don't always get somebody that's really receptive, but for the most part, you would expect that they would be, because that's basically their job, is to go ahead and stop these type of things. I know that they're pretty widespread, but if, one of the keys is if everybody thinks, oh, somebody else will call or it's not gonna do any good, then nothing is ever going to change. So I'm glad you did make the effort to call. It seems to go in waves too. Like you'll get a lot of IRS calls all of a sudden and a lot of other types of calls. But yeah, I mean, that just shows you how widespread it is, the fact that it's reached the capacity of numbers that you can block, which is pretty bad. What the Federal Trade Commission has done, though, is they ban telemarketers for asking for wiring money or reloadable cash cards. So because those are the ways that you can't get the money back. So they have basically made that illegal. Now, obviously, if it's a scam company, what they're doing is illegal anyway, but that is something that they did put into place, so hopefully it will help with a little bit. Or also just companies that maybe they're legitimate companies, but maybe they're charging you for things they shouldn't, or if there's something that's defective and you want to return it. Well, if you've paid with a reloadable cash card or you wired money, you don't have as much avenue to be able to get a credit like you can if you pay for something in a different way. So it's not a good idea basically to pay for anything, whether it's a legitimate company or not, through something that can't be traced. So that's one thing that they did recently. You want to be really careful when you call phone numbers and websites, because one single digit that's off can bring you to a scam site. Now, Medicare is on Medicare.gov. If you type in Medicare.org, or maybe you put in Medicare.gov with 2 V's or an extra R or something, it could bring you to a website that you think is Medicare and it's not. Or if you call 1-800-MEDICARE and you have a wrong digit, there's a lot of scammers that will purchase banks of numbers that are very similar to legitimate numbers. Social Security, the Center for Medicare Services, CMS, because they're kind of banking on people just hitting the wrong number. They'll answer the phone, 1-800-MEDICARE, and you think that's who you got, and you don't. So just be really careful when you're, on the web or you're dialing phone numbers, that you're careful of who you're calling. You want to shred anything that contains your personal information. Medicare sends the MSN, which is the Medicare Summary Notice, which I'm sure you're familiar with. That basically is a list of services that you receive for that 3-month period of time and what Medicare paid. Has your Medicare number on it. You want to read it and look at it. But when you're done with it, you want to shred it. You don't want to just throw it in the garbage because that has your Medicare number on it. Same with anything that has bank account information or anything like that. A lot of the communities have shredding events. I'm sure they do in Hoffman Estates. I know they do in Arlington, Buffalo Grove, that they do from time to time if you have a lot of shredding, like I do, so it might not be so convenient to be shredding on your own. They have like a secure bin that they put it in. You can watch them put it in and shred it. So that's a good thing to watch for. Or just to invest kind of in a shredder as long as you keep up with it, which is kind of hard to do, which I don't. Then you don't have a whole massive amount that you have later. And then just as you get things, and you're done with them and you've reviewed them, just throw them in the shredder. That's the safest way to get rid of that. You don't want to leave your mail in your mailbox for long periods of time. I know a lot of times with people that have health issues or they're elderly, sometimes it's not so easy for them to get through the mailbox. When we had the polar vortex, that was not a good thing. But try to keep up if you can without leaving things in your mailbox for too long, because there's a lot of confidential information that could be in there. So you want to be really careful with that. You also don't need to keep and don't want to keep your Medicare or if you have Medicaid, your Medicaid card in your wallet. It used to say keep it in your wallet at all times, which Medicare doesn't want you to do. The Senior Medicare Patrol to the state of Illinois doesn't want you to do anymore. They did take that off of the card because if you have it in your wallet and your wallet is lost or stolen, somebody now has your Medicare card, or in the past it was your Social Security number. And either one they can do a lot of damage with. People thought they needed it in case of emergency. If you have an accident and you're hit by a car or something and you have to go to the hospital, they're not going to kick you out because you don't have your Medicare card. They'll treat you and get the information later. The only time you probably need to bring it with you is if you're going to a new doctor for the first time. They're going to need it. But then put it back in a safe place when you're home. Don't just keep it in your wallet. And mostly, I'd say 9 out of 10 people carry it in their wallet. And when I do a lot of counseling through the Senior Health Insurance Patrol, when we're looking at different Medicare plans and things like that, and somebody will have it in their wallet, I'm like, okay, that's great for now because we're looking at your Medicare plans, but when you go home, take it out. And people are really surprised to hear that, and a lot of people are reluctant to do that because they just feel that they need to keep it in your wallet, but there's a lot of reasons not to do that. Also, your Social Security card, you don't want to keep it in your wallet. Okay. Let's see. So that's about protecting yourself about fraud. Any questions on that before I talk about detecting fraud? Okay. So to detect fraud, you need to know what's going on. So basically, you need to read your Medicare summary notice. Don't just say, oh, that's just a Medicare summary notice and get rid of it. It has a lot of important information on it. It has everything that Medicare paid on your account. How will you know that they're paying for services that you didn't get if you don't look at it? So I always tell people to read the Medicare summary notice, check for services you didn't receive, services not ordered by your doctor. There was an incident where someone was being billed for oxygen, rental for oxygen tanks, 2 years after they stopped using oxygen. They just kept billing it. Now, it could have been an error or it could have been fraud, but they wouldn't even know that was happening unless they checked and saw that on there. Check for duplicate billing or other type of billing errors. So it could be, not necessarily fraud, it could be a billing issue. There was somebody that was billed for a hospital. It was an 85-year-old man received charges from a hospital for maternity. Obviously, he didn't have a baby, but he would never know that unless he looked at it. And that could have been a coding issue, with the name. They transversed the Medicare number or something like that. When it's a billing error like that, you want to start, obviously, with the doctor's office first. Now, and the other thing is, you definitely want to get some kind of statement that shows that there's a zero balance, because you don't want to have an issue later on. Now, sometimes they will do audits and they'll miss things and not bill you for things at the time they're supposed to, which is why I tell people to hang on to your itemized bills and hang on to, your proof of payment until you receive something that says a zero balance. And if you do get a bill like 6 months later, which I've gotten before too, and you're like, well, did I pay this or not? It's an account balance statement. An account balance statement is not an itemized bill. It just shows what you currently do. Never pay off an account balance statement. Insist on an itemized bill, because if you're getting an account balance statement, you don't know what they're billing for. Now, this case, it's the EKG. But let's just say you get an account balance statement for like $300. How do you know what they're billing you for? So always ask for an itemized bill. In this case, I would call the billing department to try to get that straightened out. Once they straighten it out, tell them that you want something in writing showing, you want a zero balance statement, which is what I always ask for. Even though they'll say, oh, don't worry about it, we took it off, like you can see, they don't always do that. I know somebody that had that situation, and they said, oh, they took it off. They ended up being referred to a collection agency. And they had to prove to the collection agency that they actually paid it. But, which you don't want to get to that point. Not that that would necessarily happen, but you want to just really realize that a lot of times you may be getting bills 6 months later and stuff, because a lot of billing departments, things slip through the cracks. So you want to make sure that you're paying what you should be paying, get an itemized bill, and when you do pay something, make sure that you get a zero balance showing that that has been paid, and keep that for your records. And I usually say, usually within, you shouldn't receive anything, maybe 6 months up to a year is the most. That maybe they would be doing an audit or something and billing you. So that's why I tell people, either in their Medicare statements that show that Medicare paid something, keep those for at least 6 months to a year, just so that you can make sure that maybe they didn't bill Medicare. Maybe you're getting an account due statement because they neglected to pay Medicare. Or most people have a Medicare supplement policy. If you're getting account balance due statements, maybe they never sent it to your supplement plan. So you want to make sure that just keep a file cabinet, or however it's easier for you to organize that, and keep those things for a while. And also, once you do, receive services, double check on that. Don't let 3 months go by if you never got a bill. You might be happy saying, oh, I didn't get a bill, but they might send it to you a year later. So double check it to make sure it was sent to Medicare, that you have a Medicare statement. And you don't have to wait the 3 months. If you sign up for mymedicare.gov, you can also get your statements online, because they do send it every 3 months, and sometimes, you might want to get that information sooner than that. But definitely you want to make sure that you want to check it. The healthcare journal that I gave to you is a great way to keep track of your medical appointments, especially if you have a lot of them, and you're getting these Medicare statements every 3 months. A 3-month period of time, you might have several different services. So in here, it has a place for you to write down the name of the doctor, what services you received, the date. There's a place to put a medication list. And then if you fill that out, then you get your Medicare statement. You can kind of double check it against that. You can also keep track online, however it's easier for you to do, but the key to remember is just keep track of it, so that you have a way of knowing if there's any. Usually it's billing errors, but it could be fraud too. But either way, you don't want to be paying for something that you shouldn't be paying for. Good. So you also want to make sure that you report it like you did. Usually, hopefully you get a better response than you do when you call that other agency. But if you have questions about services that you received and you think it's an error, always start with your doctor first. You know, we always say give people the benefit of the doubt. It could just be an error. So if there's any kind of issue, start there. Call Medicare. But if you can't get it resolved, even if it is a billing error and they keep billing you and billing you and billing you for something and you have already paid for it, if you totally can't get it resolved or you do suspect potential fraud, you can call the Senior Medicare Patrol, which is on the red brochure here, and there's a phone number on the back. So that's a phone number through Age Options, which they administer that, and they partner with Age Options. And then you would select the option for the Senior Medicare Patrol. You'll get a voicemail, which is completely confidential. And they help with reporting and also just, resolving things. If it's something that, like I said, you keep getting billed and they're not doing anything, or they're balance billing you. If you have Medicare and a Medicare supplement, which is supposed to pick up what Medicare didn't, and you have a plan that has full coverage, they cannot bill you the difference between what Medicare, we were talking before, the difference between what they normally bill and what Medicare allows if you are seeing a Medicare contracted provider, or if you have a supplement that picks up that difference. So if you are getting balance billed and you're not getting anywhere, they can help you out with that too. So we talked about not keeping your Medicare card or your Social Security card in your wallet. That's a really, really great way to protect yourself. So with reporting, again, you want to make sure that you call your provider first. And you can also call the Federal Trade Commission if you have a lot of phone calls that are identity theft and they're not Medicare related, which I can give that number to you. So we talked a little bit about how widespread fraud is. The reason that it's really important to know about it is because it's your money, basically. It's right out of your pocket. Your premiums, your deductibles, your co-pays, all those things increase not just because of healthcare costs, but because of fraud, because it's so widespread. You can lose benefits, even more important, if there's services that were billed on your account that you didn't receive. For instance, there was an electric wheelchair that was fraudulently billed, and when that person needed a wheelchair a few years later, Medicare denied it, saying we only pay for one every 5 years and you've already received it. Physical therapy has limitations, nursing, and if those are fraudulently billed, a lot of home health care that's billed fraudulently, when you need those services, they won't be there for you. Your account can actually be flagged, your Medicare account, that says do not pay if there's enough fraudulent activity on it. So people that think, well, it didn't come out of my pocket, I received something free, Medicare paid for it, it does ultimately affect you, especially if there's a lot of fraud. It can also, actually affect your benefits that you're getting paid for. So it's very important to report that. Also, your health can get worse if you receive services that your doctor didn't order. Braces and things like that we talked about, if they don't fit properly, even if you need orthotic braces, but they're not measured properly, that can actually harm you as well. And then there's identity theft, which we talked about, that can have major financial consequences. So just remember that people who commit fraud are directly stealing from you. And it can also affect the Medicare program, which we need to be there to not even be there one day if there's this fraud that continues to be perpetrated on it and all these billions of dollars that they pay out. So some of the phone numbers I wanted to give you, you do have the SMP number, the Senior Medicare Patrol, which is on the brochure, which was 800-699-9043. Also, if you're interested in volunteering, volunteer at ageoptions.org, or that phone number will work. 1-800-Medicare, which a lot of you probably are already aware of. Make sure you're dialing right, we talked about before. Social Security, I have an 800 number, which is 800-772-1213. But if you call your local office, you will not be on hold for the rest of your life. Because I know a lot of times you call the 800 numbers, you'll be on hold forever. But if you call the local office, you'll have a lot more success in getting through a little bit quicker. The Federal Trade Commission, we were talking about all those phone calls that that you were getting. That's 877-438-4338. And the Senior Health Insurance Program, which I also volunteer with, during open enrollment, they're really great. You can go to the senior centers, offer it. But if you just have a quick question about Medicare throughout the year, they can also help. It's 800-252-8966. And I always tell people that they should check their plans every year, even though you may have a prescription drug plan that's working really well for you. Every year between October and December is your chance to change plans if you want to. And so they may change, even though your prescriptions are being covered now under your health plan, and maybe they are really, it's a great plan, the premium is really great, and their drug costs are low. That doesn't mean it's going to cost you the same next year. The premium can go up. They may no longer cover your prescriptions, or they may cover them at a higher rate. So it's always good to take a look and make sure that that's still the best plan for you. You can go online to do that through Medicare, or you can sit down with someone face-to-face. The Palatine Senior Center, where I volunteer with, you make an appointment and they help you out with Medicare, not just during open enrollment, but if you have an appeal that you need to file, or anything that kind of comes up during the year, is 847-991-1112. Also, the Arlington Heights Senior Center is 847-253-5532. But if you call the 800 number for SHIP that I gave you, they can tell you what the closest local office is to you. Those are just a couple that I know of. So the SMP, that's the Senior Medicare Patrol that you have the red brochure on, that's to report fraud. And also, if you have any ongoing billing issues that you can't resolve with your doctor or through Medicare, they help with that. And that's SMP, Senior Medicare Patrol. 1-800-MEDICARE is just general Medicare questions that you have. Did you receive my claim? Did you pay it? Things like that. Also, www.medicare.gov. They actually have some great resources online if you're looking for, you want to check out skilled nursing facilities, you want to check out a couple, just basic coverage and things like that. You can go on the website as well. Social Security, that's if maybe you didn't get your new Medicare card, or you're having an issue with the billing because they take your premium out of your Social Security. That would be when you would call Social Security, also for any kind of disability issues or general Social Security. But that's where your Medicare payments are taken out of. When they're taken out of Social Security, if you're having an issue with the amount or something, you don't want to call Medicare, you want to call Social Security for that, because they're the ones that take care of that. The Federal Trade Commission, that's for reporting not healthcare fraud per se, although they can take their calls, but the Senior Medicare Patrol is actually more appropriate for that. But that's good to call for things like the grandparent scam or the IRS, or these type of phone calls that you're getting.
What was that number?
That was 877-438-4338. So if you get those calls, like the braces and things like that, just jot down that number, and you can call the Federal Trade Commission or also the Senior Medicare Patrol on that. The SHIP number, that was the Senior Health Insurance Program. That's kind of to help you out with Medicare if you're trying to decide what the best plan is for you, or you need help with an appeal, or maybe you just don't understand how Medicare paid something and you called Medicare and you're just not getting the help that you want, or you want to sit down and talk with someone. They can tell you where your local office is. Did you need me to repeat that number? Or?
Yeah.
Okay, that's 800-252-8966. Any other questions I can answer? Well, thanks everybody for being here. I really appreciate it.
Thank you.
Have a great day. Thanks. Thank you very much. Thanks. Have a great day.